Hello, friends. Welcome. I am Dr. Harvinder Singh. Welcome to our Journal Club number 3. And topic for today is staging schizophrenia using this scale called PANSS, which stands for Positive and Negative Syndrome Scale. And the study that I will be talking today was just published 1 month ago. And the reason I chose this study is first, this is the largest sample size study done on this topic. And this is a very difficult topic to study. And also, before this study, there was no clinically relevant staging model for schizophrenia discussed. So I hope this study is clinically relevant for everyone. And I will not be going into details of this study, but I will only focus on clinically relevant facts. So I have also placed all the important links below. The PDF of this article is available for free. So please check all the links below for more details. So without wasting any time, let's begin our journal club for today. So let's begin our journal club number 3. And in this journal club, I will focus on staging of schizophrenia using PANSS. And I will talk about what PANSS is in detail. But this is the study that we will talk about. The most recent accepted manuscript in the International Journal of Neuropsychopharmacology, just published on 30th of September 2019. So just few days or weeks ago. And as I mentioned, we don't have very specific clinically relevant staging model for schizophrenia. So this was the first and the largest study to evaluate the role of PANSS, PANSS, and developing a staging method. So this study, actually the first study to report a correlation between the symptoms and duration of illness. And they also utilized this relationship of symptoms and duration of illness in making this staging model. So before we go into that, I will very briefly discuss the methodology, and actually not that I will not go into the statistical aspect again, just a brief overview. So this study actually recruited patients with DSM-4 or DSM-5 diagnosis of schizophrenia, and they also included patients with first episode. And this was actually the largest study, as I mentioned. It's a multi-country, multi-center study, 29 centers in 25 countries. And the total sample size was 2,358 patients. 60% were male, 40% were female. And they collected data on their demographic information, but also they did this scale called PANSS, which stands for Positive and Negative Syndrome Scale. So we all know what PANSS is, right? We use PANSS in research and sometimes clinically also to rate various schizophrenia symptoms and their severity. The PANSS scale mostly contains 3 scales. First scale is for positive symptoms, second scale is for negative symptoms, and third scale is for general psychopathology. But this study used a modified version of PANSS scale. Instead of 3 dimensions, this scale had 4 dimensions. And these 4 dimensions for positive symptoms, negative symptoms, general psychopathology, and excited symptoms. So what I will do is I have created a table. so that it's visually more easy to understand what this study is trying to tell us. And I have only touched the clinically relevant part here. I have placed the link for this article. It's available for free. If you're interested, you can definitely click down and read more details of the article. But let's discuss these symptoms that they compared with the duration of illness. So there were 5 symptoms here. The first one is the positive symptoms, and I will briefly name what positive symptoms they were looking at. So positive symptoms apply to delusional thoughts, hallucinatory behaviors, grandiosity, lack of judgment and insight, and unusual thought content. And then negative symptom is the second thing. There are many examples of negative symptoms. This includes emotional withdrawal, passive social withdrawal, active social avoidance, lack of spontaneity and flow of conversation. Blunted affect comes here. A person with poor attention, motor retardation, mannerism, posturing, these are all, and even disturbance of volition is included here. So all negative symptoms. Be mindful, negative symptoms are different from depression. So this is negative symptom. The third is depression and anxiety. So it's very, we all know what depression and anxiety means, but they looked at these things. They looked at depression, guilt feeling, somatic concerns, preoccupation, and anxiety here. And then fourth, which I think was very, very important here, was excitement or hostility. So this included person with excitement, poor impulse control, tension, hostility, or uncooperativeness. And then last was neurocognitive impairment. And this included person with difficulty in abstract thinking, disorientation, conceptual disorganization, stereotype thinking, suspiciousness. So these are the 5 domains that we will discuss in this journal club. And this article, actually came up with different stages of schizophrenia, right from the onset of symptoms moving forward. And they actually came up with these 4 stages, stage 1, 2, 3, and 4. As you can see, stage 2, 3, and 4 were subdivided into 2 parts, 2A, 2B, 3A, 3B, 4A, 4B. So without wasting any time, let's discuss how did these 5 symptom domain changed with each stage, or I should say progression of schizophrenia. So let's start with stage 1. And actually I will also talk about the duration so that we have a visual reminder of when these stages are happening after the onset. So for example, stage 1 on average will last for 3 years from the onset of symptoms. So this is stage 1. Now out of these 5 symptom domain, I will actually describe them either as highest during the stage, lowest during the stage, or in the middle. And in few minutes, I have also drawn some lines to see how they're progressing. It will all make sense in few minutes. Now, so in stage 1, the highest symptom is positive symptoms. So these were the dominant symptoms in the stage 1. And the lowest symptom in stage 1 was the neurocognitive impairment. And then the negative symptoms and depression and anxiety symptoms, they were low, or they called it stable. And but the excitement and hostility, started to increase during this early phase, although less than the positive symptoms. And this stage will end when excitement and hostility replaces the positive symptom as the dominant symptoms. So lesson number 1 in stage 1 is positive symptoms dominate, followed by excitement or hostility. And I think we all know from our clinical experience the positive symptoms are dominating when someone is diagnosed with schizophrenia. So this lasts for 3 years on average. It can be less, it can be more, but average is 3 years. Now moving on to stage 2. But let's look at the duration first. What I will do is the total duration is actually 9 years for stage 2. But for 2A and 2B, they have separated into 2. So in those 9 years, the 2A stage lasts for 3 years. So it reaches that 6-year mark from the time of onset. And stage 2B lasts for additional 6 years. So thereby we reach that 12-year mark. So 3-year to 12-year is a period of stage 2. But you can see that stage 2B is longer than stage 2A. Now let's see which symptom will dominate here. So in stage 1, positive symptom was dominating. In stage 2, excitement and hostility are the dominant one. So you will see a lot of these dots going into picture now. So the excitement and hostility continues to increase from stage 1 here. Now, stage 2A, they are increasing, but in stage 2B, they start to go down. And they called it stabilization of excitement or hostility. But still, in stage 2 in total, excitement and hostility were the dominant symptoms. Just like positive symptoms were dominating in stage 1, in stage 2, excitement and hostility were dominating. What about the positive symptoms? Well, actually they start to remit, starts to go down, starts to stabilize. As you can see, in stage 2A, they were in the middle, but they go to the lowest part in stage 2B. So this is the time period when you see improvement in the positive symptoms. Now, clinical question here is this because a person is on antipsychotics, or is this the normal process of schizophrenia process? So the answer is not known, but something to be mindful of. Now let's discuss other symptoms, other symptom domains in stage 2. So in stage 1, we saw how negative symptoms and depression, anxiety were low. In stage 2, they actually start to increase also. And they say that by the time stage 2A ends, the negative symptoms, depression and anxiety have overrun positive symptoms. So when you see in that middle, they are more than positive symptoms, both negative symptoms and depression or anxiety. And in stage 2B, you can see that both are increasing. And they say that stage 2 ends when depression and anxiety have exceeded excitement or hostility as a dominant feature. So what they're trying to say is by stage 3, depression and anxiety are dominating. For example, in stage 2, excitement and hostility is dominating. In stage 1, positive symptoms were dominating. In stage 3, depression and anxiety will be dominating. We'll talk about that. But let's end the stage 2 by talking about neurocognitive impairment. What's going on there? Well, they also start to increase, but they are still on the lowest scale right now compared to other symptoms. And they say they start to increase by 2B. In 2A stage, they are still stable, but again, they are not much relevant in stage 2 yet. So I will repeat again, stage 2 will end when depression and anxiety have exceeded excitement and hostility symptom. So let's start with stage 3 now. Stage 3 actually lasts 13 years on average. So that actually brings us to, when you add that to 25 years since the age of onset. And but let's begin with the symptoms. As I have repeated few times now, the main symptom that will dominate in stage 3 is depression or anxiety. And you can see on top, the time period is still 25 years now. So this is the longest stage out of all 3 so far, from age 12 to age 25 from the time of onset. Stage 3 is the dominating one. And in this, depression and anxiety will be dominating. They actually continue to increase from 3A to 3B. But you will see by the time 3B is about to end, depression and anxiety starts to go down. But overall, depression and anxiety dominates in this stage. And how about other symptoms now? So how about other symptoms now? After depression and anxiety, the second common one here is negative symptoms. And you will see how negative symptoms are continuing to rise. And by the time the stage is over, they are little higher than depression and anxiety. And actually this also applies to neurocognitive symptoms here. You will see how they are still lower, but they continue to rise. And they actually also mention that this stage ends when neurocognitive symptoms have exceeded depression and anxiety, which is very interesting. So, and then in the end, positive symptoms, we still have 2 more. So about the positive symptoms, we have seen how they are still low, but they are the lowest of all right now. So you won't see much of the positive symptoms here. And same applies for the excitement and hostility. They are lowest in stage 3 right now. So let's summarize stage 3 again. Depression and anxiety are the dominating symptoms here. After that, you see negative symptoms, and then you see neurocognitive impairment reaching that higher level now. But positive symptoms and excitement and hostility remains on the lowest part right now. Now, moving on to our last stage, stage 4. Stage 4 is very long phase. So it has 4A and 4B. So 4A actually can last for 25 years after the illness onset. It starts after the 25 year after onset, but it can last from age 25 to age 40, and then from 40 years onward is stage 4B. But let's talk about the symptoms. Which symptom dominates here? This is the stage when there is marked increase in the neurocognitive deficit here. This is a dominating symptom from 4A to 4B. And you can see on the top, the time period is all full for all stages now. We'll talk about that in the end for a few seconds. But neurocognitive deficit is highest right now. After neurocognitive deficit, the second symptom that is increasing here is negative symptoms. Now, make a note that in 4A, compared to neurocognitive impairment, negative symptoms are not that high. So neurocognitive impairment have marked increase. Negative symptom have less robust increase compared to neurocognitive deficit, but they are increasing now. Now, the interesting thing is the excitement and hostility part, which was coming to the lower part, will show mild increase at the beginning of 4A and then it can go to middle and high level. So this is a part where, in addition to neurocognitive impairment, at a later stage you may see symptoms of excitement or hostility. So they mentioned that by the time they are at 4B, end of 4B, negative symptoms are replaced by excitement and hostility as a second common symptom after neurocognitive impairment. Regarding depression and anxiety, they will continue to decline from 4A to 4B, and they are the lowest by 4B. And the positive symptoms, they continue to stay low, may go to middle, but they still remain on the lowest part. So this is our full table. I have placed the picture of this below on our website page, on the website post. But you can see how these symptoms are progressing here. Let's start with the timeline very briefly. So stage 1, and it's all from the time of onset of symptoms, not from their birth. So 0 is the first onset of schizophrenia symptom. For first 3-year average, stage 1. 3 to 12 year is stage 2. 12 to 25 is stage 3. 25 to 40 is stage 4A, and 40 year plus is stage 4B. So you can see. Now let's spend some time on only the dominant symptoms domain in each stage now. Look at the one in red. Positive symptoms dominate in stage 1. Excitement and hostility dominate in stage 2. Depression and anxiety dominate in stage 3. And then neurocognitive impairment dominates in stage 4. Now, few thinking point, or I should say few clinical facts from this study, but I will again recommend please read the full study for more details. What I will point now is only few important points for clinical relevance, but please read the article for more details. Now, one thing that I mentioned already is that positive symptom decline after stage 1. We don't know if this is attributed to the antipsychotic treatment versus the underlying schizophrenia progression. But very important lesson is that with time, don't only rely on positive symptoms. You need to evaluate all the other domains here and then treat accordingly. For example, the depression and anxiety domain dominates for a significant portion of these stages. Like stage 3 is the longest, right? So you need to evaluate your patients for mood symptoms and treat accordingly, especially with the antidepressant if indicated. And the authors also mentioned this excitement or hostility. Could this be an underlying undiagnosed mania or something like that? They don't know. Actually, no one knows yet. Now, one more clinically relevant point they talked about was difference between males and females. They were not able to find any statistical difference, but there were few important facts here. First is females have less negative symptoms, but more depression and anxiety symptoms, whereas males have more negative symptoms and cognitive deficit with psychomotor abnormalities. And also studies have shown that females have shorter stage 1 and stage 2. But this was not a significant finding in this study, but many studies have shown that. So they actually talked about that very briefly here, that females get into stage 3 faster than males. And could that be attributed to some changes in response for females over males? They don't know. But friends, this was our very brief overview of this article findings. I will repeat again, please read the article. I will put the link below, and this link is only actually available on the website post and for our course subscriber on in a course chapter. So this video and details are available on our website, and this is also available on YouTube. Please subscribe to YouTube if you have not done already. And then this is also available as our newest chapter. I think this brings our chapter count to 233. So if you have not subscribed to our course, Physician's Guide for Clinical Psychiatry course, please do subscribe. So thank you, friends. Again, I'm Dr. Harvinder Singh. I will see you all in our next chapter or video or post on the website. The best way to stay up to date with everything is to join our email newsletter. Thereby you will get the updates if I post something new on our website, or post a video on YouTube, or post a new chapter on our course. I will put all the information below regarding a link to join our email newsletter, link to subscribe to our course, and link to the post on the website. So thank you, friends. You all have a good day. Take care. Bye.